A very important question that everyone who is going to get in touch with AS Global Healthcare Academy that I want to address today is why AS Global Healthcare Academy? What makes AS Global Healthcare Academy different from other forums that are running internationally? The main thing that I would advocate and I can present anywhere in the world is the course content. Okay, the course content is designed in such a way that it is covering every aspect of international registration exams. I am not only emphasizing on your clinical skills, I'm not only emphasizing on your therapeutic skills, but I am going to make you master in the toughest fields of pharmacy like medicinal chemistry, like biopharmaceutics. I come across a lot of students who feel a lot of difficulty in cracking the pharmaceutical calculations. And the most important thing that most of the courses internationally, they are lacking the interconnection between different subjects of the pharmacy that are being asked in exam. So I am going to bridge your knowledge that how biopharmaceutics is related to the clinical care, how biopharmaceutics it is related to the medicinal aspect, how certain pharmaceutical aspects of the drugs, they can impact the clinical outcome, the therapeutic care. So these are the things that is going to make you master anywhere you are going to practice your pharmacy. Another thing that I would like to mention here, that my course is revised biannually. 2 times a year, whenever I'm going to launch a next batch, I revise my whole course. Now, I will give you an example that let's say we are talking about any kind of exam and you look at the description of that exam, and at the end of that description, you come to know that there are at least 7 to 9 books recommended to cover only your clinical area. Now, humanly, it's not possible for a candidate to cover those 7 to 9 books in the period of 6 months or even in the period of 1 year. So I'm just talking about one subject and 7 to 9 books are recommended for one subject. So how do we tailor our course? So we just consult all of those recommended books and we extract the data from those recommended books that are required for your exam. And ultimately we compile it in one PDF, and then that PDF it is discussed live. Now, what is the purpose of discussing live lectures with the students? That any kind of question that is popping up in the mind of the student at that particular time, they can just ask me there. I will clear the concepts over there, and after clearing the concepts, I will take a mock exam from that particular topic, so that you know that I have the understanding of this topic, but how this understanding is going to be asked in the exam. So you are continuously throughout 6 months, you are being practiced. Yes, I have covered the antihypertensive drugs. What kind of questions are going to be there from antihypertensive drugs, from the medicinal aspect, from the biopharmaceutical aspects, from the pharmaceutical aspects, from the community pharmacy side, from the regulation or law side, or even from the clinical or therapeutic sides. So these are the things that we emphasize on. And the last but not the least thing that I work on each and every student individually is their communication skills. Because we as healthcare professionals, we have a lot of knowledge, but how to communicate that knowledge to the person who has zero knowledge of medicine? Like I have a person who is engineer and who is coming to me getting guidance about a particular drug. So I will not be using like bulky terms that are understandable by the healthcare professionals only. So this is the things, these are the points that I educate and I train my students that how to improve your communication skills as a clinical pharmacist. So I always educate and I always recommend my students that first thing when you are talking about community is your confidence. You should have a good knowledge. That good knowledge is going to give you the confidence. Second thing I always educate to my students is know your audience. If my patient is a female who is from a far-flung village that even does not know how to read, so I will not be communicating with her that this drug is going to give you dyspepsia. That will be flying over her head. Okay, so according to the audience, we should know that what kind of communication skills, what kind of knowledge we are going to address to that patient. We don't want to overwhelm the patients with a lot of knowledge. We don't want to undereducate the patients so that the drugs can have adverse drug reactions or the drugs will not have any effect on the patient. So always know your audience, always know your patients, always know your people who are you communicating with, and that communication is a skill and that has to be learned with the passage of time. In one day you are not going to be a very good communicator, but it takes a lot of time and effort. But again, for that time, effort and that skill, you need a base to stand on, and that base to stand on is this 6 months clinical course, 6 months international registration exam course that will help you stand in any kind of difficult or any kind of easy scenario that you can crack easily on the basis of your understanding, good communication skills.